the basic concept of imaging. I would rather speak in total, just to give you a glance, and I want to say that old is gold. Like, I've seen many practitioners, they are ordering for a CT, MRI, all this. Go for an ultrasound, go for a radiology. But anything related to soft tissues in the abdomen or in the abdomen especially, if you feel a lump or something like that, then go for an USG. And if you are thinking that you need an FNAC, fine needle aspiration cytology, fine needle aspiration cytology, then you order with the ultrasound USG guided FNAC. Now the sonologist does with his probe, he scans the whole abdomen, and then he tries to correlate from which organ it is, from kidney or from liver or some intestine. Now with this, then if the like with colored Doppler study, when that means to see the blood flow to a specific area, is it increased or it is highly vascular? It can be a hemangioma, it can be a tumor mass. So he does a USG guided, and if he fears or if he is knowing that this might lead to some catastrophe, then he will suggest a CT MRI. Okay, that is the content. But X-rays, just now today, a man came with a swelling of the left arm. Okay, high cellulitis, the deltoids are swollen, and he was having pain. But yesterday, my assistant contacted me. I told him, you give some antibiotics, some emollient cream. Okay, cellulitis was there. And then today I happened to see that patient. Now what I ordered is, I ordered the shoulder joint X-ray, AP lateral view. Okay, then I ordered for a humerus, radiology of the humerus with that is one, AP lateral. And then I asked for an ultrasound, request for an ultrasound of the muscle, deltoid. And 10 days back, he gave a history. I told him, "Kyo injection diyechilo? Anyone given you an injection?" There was no. And na korlo. Then he said, "At a shirate injection diyechilo." He was having some fever or something like that. Now, there's a tendency nowadays, there's costly some injectables, antibiotics. Okay. And you see, anyway, that was not noted. And now, what are the things, possibilities? It can be a abscess in the deltoid region. It can be, but that was given an not intermuscular, but intravenous. Now, in what happens, even if asepsis is not maintained and contamination is there, then if you give an intramuscular injection, then sometimes abscess happens. So what we're going to do is the ultrasound, the X-rays, I ordered for 3. Now, a quick in the he's a daily laborer, and at present in the fields your crop is there, harvesting season. Now he just said, আমি বললাম তুমি ধান কাটছো? হ্যাঁ, বলে যে এসছি, এটার জন্য আর পারছি না। That means this is one thing that he was working till just 5 days back, but he came with such a swelling, and I ordered today, and just simple blood tests, that routines, CBC with hemoglobin and all this, then your blood sugar, random sample, and your I just give you the antibiotics for next 5 days, but tomorrow by you get the report, it will be sent to my WhatsApp. I will be seeing and reviewing. Now, if that report is something like any, now I will see the other possibilities that the humerus or some a malignancy, osteosarcoma. It can be osteosarcoma. So you anything, but don't go for an MRI, CT, or what I want to say is that at least digital radio diagnosis, digital X-rays, they give you a soft tissue swelling. The bone is clearly delineated, that it is not fractured or some growth is there. It is not there. But to these two, the radio, say X-rays will cost you max to max 500 rupees. Two, shoulder joint and humerus, 200 rupees or 300 rupees, anyway 500 rupees. Another ultrasound, it can be 1500 to 2000 maximum. And if he finds this thing, you put in any sol or thing, you can do an FNAC. If it is an abscess, the abscess, pus will come out doing an FNAC. Then this is one thing. Now you have to know the anatomy. Now what we say, the ossification of upper end of the humerus. Now this is the 11 years female, and same Aradalaha, 11 years female. Now what I want to say is that you see a viewer radiological plate. You have to see here, this is the left, L is there, here. The information in a radiological plate is there. Patient's name, it can be XY. We are not bothered about the name. Age, if it's an adult or not. It's just 11 years girl. Now, with this background, if it is an adult, the age will be there. And what part is showing, the right side or left side, that you marker they have to put before showing this thing, taking the X-ray. After putting the plate, then there's, but in digital this thing format, they are putting right or left. If it is right, then right, left. Now the examiner, in case, nowadays you are having sheet, you have to answer what you have viewed, what things are there, what are the diagnosis. Diagnosis is what you are seeing. It is not that you have to diagnose the disease in anatomy. But the method of approaching a radiograph is in this way you have to approach. Okay, and now the you can see the ossification is not complete. Okay, now ossification of the upper end of humerus, secondary center for head is 1 year, Secondary center for greater tubercle is 2 years. Secondary center for lesser tubercle is 5 years. 1, 2, 5. Okay. Now, 3 centers fuse together at 6 years. Epiphysis fuses with shaft at 20 years. Epiphysis, metaphysis, diaphysis. Okay. And these centers, this thing, you see and correlate with your, okay. Now, see, epiphysis in shoulder region, head of the humerus 1 year, coracoid process 1 year, greater tubercle 1 year, lesser tubercle 5 years. 1, 1, head of the humerus 1 year, coracoid process 1 year, greater tubercle 2 years, lesser tubercle 5 years. The fusion of head, greater tubercle and lesser tubercle 6 years. The fusion of the head and greater tubercle, lesser tubercle and 6 years. Fusion of coracoid process with scapula 15 years. This is the coracoid process. Okay. Now fusion of upper end of humerus with shaft 20 years. Now the upper end gets fused at the age of 20 years. Now this is the significance in jurisprudence that you find only 2 bones or 2 humerus of 1 femur. Then only that is the thing at the site of crime. Only these 2 bones are found. Now you have to go and then take the radiological radiology of these dead bones. Then you will find this picture if it's a child or an adult but dwarf. You get it. It's a small size bone. But you are not knowing that it's 11 years or 15 years or 12 years or 20 years or anything. Now by age you can estimate by the ossification of the respective bones. Now this is the thing that you have to keep in mind why ossification is so important. There can be a short note on ossification. It can be in the when you in the gross anatomy, when you are doing osteology, then the examiner asks you to hold a humerus. It is not that don't be your best and focused. Only radiology te jigesh korbe. Only during X-rays, 5-10 marks or something like that, they'll ask. No, it can that you are answering very good, very good, very good. I want to give you honors, 80, 90 I want to give you. Then I'll ask you that what is the ossification centers. Okay. Now this is from gross anatomy. The radiology, শুধু যে রেডিওলজি ক্লাস হচ্ছে রেডিওলজি নিয়ে ওই অসিফিকেশন সেন্টার ওইটা ওই প্লেটে যতক্ষণ দেখাবে বাট ইট ক্যান হ্যাপেন, ইট উইল হ্যাপেন that you want to get an honors and I want to give. I don't carry marks in my pocket. I give. But you have to say something, speak out. And if you are speaking out, then I will give you. You're answering nice, 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 nice. Then I'll tell you, okay. Then the examiner can ask you from regarding ossification in the gross anatomy part. So don't be thinking that ossification will be asked in these 2 plates. And the 10 marks question of ossification centers and the of fusion or 5 marks or your MCQ. Okay. Now ossification of lower end of humerus, secondary center for capitulum and lateral phalange of trochlea 1 year, secondary center for medial phalanges of trochlea 9 years, secondary center for lateral epicondyle is 12 years. 3 centers fused together 14 years. Epiphysis fused with shaft 16 years. Secondary center for medial epicondyle 6 years. Epiphysis fuses with the shaft at 20 years. Now the shaft fuses at 20 years. It had a motamoti onker moton. It's like mathematics. Okay. And when you are studying ossification centers, then you draw a picture. Always illustrate. Anything. You don't have to take a scale and make it a straight line and this thing. Just draw a head. And then you draw lower end, upper end. And epiphysis, diaphysis, একটু gap দিয়ে করলে, then you just mark. Okay. Now, ossification of the upper ends of the radius in Allah. Now, radius, secondary center for head 4 years. Epiphysis fused with shaft 18 years. Allah, secondary center for olecranon process 10 years. Epiphysis fused with shaft at 16 years. 4, 18, 10, 16. Now, X-ray of the elbow joint. This is the right elbow. The lower end of the humerus. This is the olecranon process of the ulna. This is the radial head. And they form the forearm bones. This is the posterior aspect. This is the lateral aspect, the anterior posterior aspect. See how it is. You already seen the thing. You have seen the humerus. You have seen the olecranon process. But when you are going for your viva, okay, catch hold of the humerus. First thing is that you identify the olecranon fossa in the posterior aspect. You see the olecranon. Then you see the head where it is medially, or you have hold it in laterally. The olecranon fossa is one key to the lock. Typically, nile degle pechon thekte fossa, hold it. Every bone has a key, a lock and a key, not master key. Okay. Okay, now I'll tell you. Now these are lateral views. See, this is not ossified, still not ossification. Now, ossification of lower ends of radius and ulna. Now, radius, secondary center for lower end is 1 year. Epiphysis fuses with shaft 20 years. Ulna, secondary center for lower end is 5 years. Epiphysis fuses with shaft at 18 years. Now, ossification of carpal bones. Now, hamate, capitate 1 year, tricutal 3 years, lunate 4 years, scaphoid 5 years, trapezium 5 years, trapezoid 5 years, fusiform 12 years. X-ray of the wrist joint. See the styloid process of the ulna. This is the radius. This is the styloid process of the radius. X-ray of the wrist joint. See all the bones. Here the bones are not yet come. It's a baby, and see now slowly the bones are there coming. This is a pisiform. See, these are the carpal bones are not ossified. Now this part is there. Then you will just 5 of you will come and view the radiograph. Okay.